Okay, welcome everybody. Thank you for joining us. This is an important discussion. As everybody in our community knows, we're deep into this fourth wave. And I thought it was very important from a community perspective that we get a sense of perspective of what is happening out there in terms of the numbers. And so I've brought on into this discussion Lance Abramson, chairman of Hatzolah, and Dr. Richard Friedland, CEO of Netcare, and of course, a crucial member of our Schul's advisory panel. And so, Lance, maybe we'll start with you just to get a sense from a community perspective. What's happening out there and how are you seeing things?
Sure. I'm just going to share my screen over. You can let me know if you can see this. Let me know when that pops up.
Yes, can see it. Thank you, Lance.
Okay, great. So this is, feedback, obviously, from Hatzollah's perspective. This is the Johannesburg numbers that we're currently seeing in this fourth wave. And, sorry, there we go. Okay, so last week we had 682 new patients onto our home wellness program up here in Johannesburg. And that is a very high number in 1 week. It's the same kind of level as the peak of the third wave. So the numbers that we're seeing are very high. And what's interesting is when you look at this graph, this is very interesting, is that 4 weeks ago, we only had 10 patients on the program, and then it jumped to 38, then 128, and in the fourth week, up to 682 people, new patients in 1 week, which is obviously, this new variant is obviously very transmissible, and people are really catching, COVID quite easily. And this week so far, we're on 465, and we're sitting here, it's Wednesday morning. So this week is also obviously going to be, again, another very high number. So in terms of the virus spreading, it is obviously spreading very quickly. The interesting thing is, you can also see it in this graph over here, is that, just see, there we go. So this was the first wave, 263 active cases we peaked out on. Second wave, 333, and then we had this huge third wave, 1,217. And now in the fourth wave, we're already on 1,055 patients. And look at this graph, kind of went vertical over here. We didn't see that in any of these waves, which had a much, slower, I mean, it's still steep, but a much slower lean into the wave. This has just gone absolutely vertical over here, the number of new patients onto the program. So that's the in terms of transmissibility, but in terms of the sickness of the patients that we're finding at the moment, even with all of those patients, we only have 6 patients in hospital currently, and we only have 10 patients on home oxygen. And that's kind of less than 2% of the patients we're currently looking after are, in a more kind of have a more severe illness, let's call it. And this graph is very interesting because what this shows is the number of active hospital admissions through all 3 waves. So in the first wave, at the most we had at one point of our patients was 22 community members in hospital at one time. And then it went up and down and up and down. The second wave, the most we had was 44 patients in hospital at one time. The third wave, we jumped up, we had 68 patients from our community off our program in hospital at one point in the program. And as of today, in terms of hospital admissions, we're still sitting right down here at 6. So that is a very, very interesting number. And you can just see it in the green line. You can see that the number is low over there. And, we're just really hoping and praying that it stays this way, and that we have a wave now, which is a lot more people are getting it, but it seems to be that the severity of the illness from our perspective is less. And obviously we hope and pray that it stays that way. That would really be good news if that carries on like that, nowhere near these peaks that we saw previously. Just in terms of vaccination stats within our cohort, so we have 72.2% of the people on the program are fully vaccinated. And that's saying 2 things. It's saying that fully vaccinated people are still able to get COVID right now, but, and so obviously because of that, they do have to take all the usual precautions that we still have in terms of masks and socially distancing, etc. All those precautions still apply, even if you are fully vaccinated. But it is likely, very likely, that huge number of vaccinated people is a big factor in keeping the severe illness down. So we have so many patients that are getting COVID, but so few of them have at the moment what we are seeing as, very few of severe illness. And, I have no doubt that the vaccinations are playing a role in that. We also have 9.7% partially vaccinated. We have 18% unvaccinated, but of that 18%, 11.3% are under 12, so they're not eligible. And we only have 6.8% who are eligible and still unvaccinated. And that's really a relatively small number. And, that is a very interesting statistic from our perspective. Just put the numbers up again. If anybody does get COVID, you want to register on the program. The top line is the number there. You can call that number, or you can click on that link, and that's where you'll be able to register on the program. And just want to end off with a very, shout out to our team. This week we passed over 8,000 patients that we've cared for since the beginning of COVID. And really, kol hakavod to the team, a magnificent effort from them for all of that. A huge amount of work, and well done to everybody for that.
Lance, thank you so much, and please convey to your team on behalf of all of us our grateful thanks to them for their heroism in the face of this. And also the statistics which you share. I was in contact with CSO Medical in Cape Town, and they're also seeing, rapid rise in infections. But at the moment in Cape Town, thank God, not a single hospitalization or anyone on home oxygen, although they did stress that obviously the trajectory is a little bit behind Johannesburg, but it does accord exactly with your numbers. And maybe, so thank you so much for sharing that. Pleasure. And for everything that you do for the community. We're so grateful. May Hashem continue to protect and bless your volunteers and professional staff. Dr. Friedland, now just to come in there, does what is presented here from Lance, are you seeing similarly on a national level, and what's your view based on these numbers where the infection rates are high but the hospitalizations and serious illness is low? How are you seeing the national perspective? Would be so grateful if you could share that with us. Dr. Friedland, I think you're still on mute.
Thank you very much, Chief Rabbi, and a shout out to Lance and his team at Hatzolah for the outstanding work that they've done right since the beginning of this COVID pandemic more than 18 months ago. The picture that we are seeing across Netcare's 49 hospitals and across our more than 60 primary care centers, medical and dental centers, mirrors exactly that which Lance has been describing earlier. And just in summary, a few salient features. Firstly, we are seeing in this fourth wave an extremely transmissible virus. And we can see the rate of community spread is very, very rapid, almost vertical. When you look at the curves that Lance showed you, those same curves are being mirrored across South Africa. But we aren't seeing a commensurate increase in hospital admissions. And we phrased this or coined this phrase of a decoupling between the rate of community transmission and the rate of hospital admissions. And that's important because in the first three waves, both of those correlated very well. And as we saw a rise in community spread, so too did we see the rate of admission of very sick patients to hospital. Let me give you an example. Earlier this week, we crossed the 26% barrier, or breached the 26% level of the number of people testing positive in the country. Now, when we did that in the first wave, we had over 2,000 patients in hospital. In the second wave, over 2,200 patients. And in the third wave, when we breached 26% for the country, over 3,000 patients. Today, as we speak, we've got 337 patients in our hospital. It's virtually a tenth, a fraction of the similar amount of patients. Now, some of that may be due to the fact that this has been such a rapid rise in the number of community spread. But importantly, the vast majority of patients we're seeing in our hospital are incidental COVID cases. In fact, 90% are. What do I mean by that? In the first three waves, we were admitting very sick patients. Every one of those patients required some form of ventilation, and unfortunately, many required some form of oxygenation, and unfortunately, some required ventilation. In fact, of the 120-odd thousand patients we saw over the first 3 waves, 44% of those were admitted to hospital, and 26% required some form of ICU care. So overall, very sick patients. I can tell you as of today, only 10% of the patients who are COVID positive in our hospitals require some form of oxygenation. And the remainder are what we call incidental cases. They've been admitted because of trauma, they've come in for surgical procedures or other diagnoses, and we happen to have found COVID. We're seeing a very mild form of COVID through our primary care clinics. In the Gauteng, we've seen about 30,000 patients since the 15th of November when cases started to rise. And I can tell you of that, only 1,000 have tested positive, and they all are experiencing a mild to moderate flu-like symptoms, a blocked nose, a runny nose, sore throat or scratchy throat, and a headache. So thus far, and I know it's very early days, it appears that this virus or this variant is causing mild to moderate illness. Definitely there is vaccine escape because people who are vaccinated are still getting this, but it's a very mild form. We don't know at this stage whether it's going to cause severe illness or not. We're not seeing that. I can tell you that we've had 7 deaths in our hospital since the 15th of November of patients who are COVID positive, 4 of which we can ascribe to COVID-19. And I can tell you in those 4 patients, all of them had severe comorbidities, and 3 of those patients were not vaccinated. In fact, of all the patients, COVID patients we've admitted since the 15th of November, some 800 patients who are COVID positive, 75% are not vaccinated. And so I think there's a very, very important public health message. We need to encourage everyone. It is probably the single most important issue is to get vaccinated and make sure that you receive your boosters. I think the second issue, it's been shown unequivocally that the wearing of face masks substantially reduces the transmission of COVID-19. And I think getting vaccinated, maintaining social distance, and most importantly, wearing a face mask are absolutely critical. So in summary, if I may say, at this stage, this early stage, it does appear that this is a very mild to moderate form of COVID. We believe, with the exception of a few cases, it can be treated very well at a primary care level. Of course, those patients that are elderly, those with comorbidities may well need to be admitted. But at this stage, those are less than 10% of the patients we're seeing in our hospitals at the moment. And the last message I would say is, please vaccinate, please wear a mask and maintain social distancing. Thank you.
Dr. Friedland, thank you so much for that presentation and for all of your guidance throughout the almost last 2 years. For me personally and for the community, and guiding our shuls and helping us in these sessions and these webinars to be able to get perspective. But I think without wanting to, and I think it came very clear from your presentation and Lance, which is corroborated by the community numbers, that and I think that there is a real sense that this 4th wave we seem to puts us in a much better position than we've ever been throughout this pandemic. And I think it's while at the same time as you and Lance are both stressing the importance of vaccination, which we can see to prevent a serious illness, mask wearing and all of that, I think it's also important as a community and as a world that we look at these real numbers, granted with the caveats, Dr. Friedland, that you mentioned, that it is early on, and have a sense that perhaps there is light on the horizon. Dr. Friedland, is that, I don't want to put words in your mouth, but is this a sense of some light on the horizon here, that we're starting to see this pandemic beginning to weaken, and that we can start, with all the caveats of maintaining the safety precautions which are in place. But I think, yeah.
Yeah, so I think, thank you for that. I think it is very early days. We're only just over 3 weeks since the Omicron variant was identified in South Africa. We now know it's existed elsewhere in the world, which makes a farce of the current travel ban, because it was present elsewhere in the world long before we identified it here in South Africa. But having said that, if this trend were to continue, and again, we've only seen it over the last 3 weeks, of a very mild to moderate form of COVID that can be really managed at a primary care level, then I think that augurs extremely well for the evolution of this fourth wave and COVID. We do call this antigenic drift. When the virus attenuates, it does become more transmissible. And this was seen towards the end of the Spanish flu. Now, I recognize it's far too early to call that, but there are early signals. Again, after 3.5 weeks, perhaps a bit too early, but I think we're all praying and hoping that this will continue.
Okay, thank you so much. So appreciated. And I think, just perhaps as a closing message to our community, to follow the advice given here today, from Dr. Friedland, from Lance Abramson, the importance of vaccination, the importance of wearing face masks. At the same time, I think this is the beginning of a conversation which has to happen not only within our community, but within our country and the world, where the world needs to be driven by rationality and by numbers. And ultimately, the facts on the ground need to be able to speak and inform public policy. And as Dr. Friedland mentioned, the travel bans and the like, which are now not in accordance with and not a reflection of the numbers on the ground. And I think that's a very important part. As human beings, we have rationality, facts, and numbers. That is what Hashem has given us, and our sages teach us that the importance of approaching life from a rational perspective, understanding the facts on the ground. There's a statement in the Talmud where it says, "Ein l'dayin ela ma she'einav ro'ot," that the judge has what the facts that he sees before him, and we need to be informed and frame our decisions on that. And those facts give us clear indications of our responsibilities from a health perspective, the mitzvah to vaccinate, to take the precautions, to put on face masks, and to be careful, but at the same time to look forward to a future where we can start to see the light on the horizon and to have hope for a better tomorrow with the healing, and to give thanks to Hashem, to recognize the invention and the discovery of the vaccinations and the ability for society to deal with this disease is a blessing from Hashem in partnership with the scientists. But nothing in this world happens without the blessing of Hashem. That's also what we learn in this week's parasha by Yigash, where we see with Yosef, he was governing Egypt, and he put in place plans to be able to take care of the years of famine based on the years of plenty. But at the same time, our sages teach us that Joseph mentioned God's name all the time, putting in plans based on rational planning and a rational planning for society is a very important mitzvah. And at the same time, to have faith in Hashem and recognize his hand in everything, and to give thanks to Hashem when we see the blessings, and to realize that we are indeed in his hands as his partners to make this world into a better place. Thank you, Dr. Friedland. Thank you, Lance Abramson. Thank you, Hatzolah, for your remarkable work, and CSO Medical in Cape Town for your remarkable mitzvah work, and Dr. Friedland for your leadership and guidance and contribution to our community and to our country. Thank you all, and may Hashem bless our community, our country, and our world with health and healing.